हेलो एवरीवन, वेलकम टू द नर्सलाइफ एकेडमी। आपका हमारे यूट्यूब चैनल के अंदर एक बार फिर से स्वागत है। एंड टुडे वी विल डिस्कस अबाउट द वेरी इंपॉर्टेंट क्वेश्चंस और टॉपिक है अपना हाइपरटेंशन एंड कोरोनरी आर्टरी डिजीज। ऑल क्वेश्चंस आर द एनक्लेक्स बेस्ड एंड प्रायोरिटी बेस्ड। सो वन बाय वन अपन सारे क्वेश्चंस और उनके आंसर के बारे में डिस्कस करने वाले हैं अकॉर्डिंग टू द प्रायोरिटी। सो लेट स्टार्ट द क्वेश्चंस। क्वेश्चन नंबर 1। A client is scheduled for a cardiac catheterization using a radiopaque dye. Which of the following assessment is the most critical before the procedure? And option A, intake and output. Option B, baseline peripheral pulse rates. Option C, height and weight. And option D, allergy to iodine for selfies. So, what is the right answer? So, what is the right answer? What is the right answer? So the right answer is the option D. The right answer is the option D. Allergy to iodine and selfies. Before the cardiac catheterization अपन वहाँ पे रेडियोपेक डाई यूज करते हैं। तो अपन को वहाँ पे पहले से अपन को पता होना चाहिए कि वहाँ पे इससे पेशेंट को एलर्जी है या नहीं है। सो द राइट आंसर इज द ऑप्शन डी। नेक्स्ट क्वेश्चन। A client with no history of cardiovascular disease comes into the ambulatory clinic with the flu-like symptoms. The client suddenly complains of the chest pain. Which of the following questions would best help to nurse to determine pain caused by non-cardiac problem? Option A. Have you ever had his pain before? Option B. Can you describe your pain to me? Option C. Does the pain get worse when you breathe in? And option D. Can you rate the pain on a scale of 1 to 10, with 10 bring the worst? So right answer is the option C. Does the pain get worse when the breathe in? ठीक है, पेशेंट को वहां पे पेन है, वो किस टाइप का हो रहा है उसके बारे में पता करना है। सो द राइट आंसर इज द ऑप्शन सी। नेक्स्ट क्वेश्चन। A client with the myocardial infarction has been transferred from a coronary care unit to a general medical unit with cardiac monitoring via telemetry. telemetry. A nurse planned to allow for nurse of allow for which of the following client activities? Option A, strict bed rest for 24 hours after transfer. Option B, bathroom vigilance and self-care activity. Option C, unsupervised halfway ambulation with distance under 200 feet. Option D. Option D. Add leave activity because of client is monitored. So what is the right answer? So what is the right answer? And the right answer is the option B. Bathroom privilege and self-care activity. Right answer is the option B. Next question. A nurse not two pulse. A nurse notes 2 plus bilateral edema in the lower extremities of a client with the myocardial infarction who has admitted 2 days ago. The nurse would plan to do which of the following next? Option A. Review the intake and output recorded for the last 2 days. Option B. Change the time of diuretic administration from morning to evening. Option C. Request a sodium restriction of 1 gram per day from the physician. And option D. Order daily weight starting the following morning. पेशेंट को क्या है, एडिमा है +2 बाइलेटरल एंड कहाँ पे, लोअर एक्सट्रीमिटीज के अंदर। पेशेंट आर एडमिटेड 2 days ago. सो व्हाट वी डू नेक्स्ट? तो व्हाट इज द राइट आंसर? राइट आंसर इज द ऑप्शन ए, रिव्यू द इनटेक एंड आउटपुट, लास्ट 2 डे के अंदर पेशेंट का जो भी इनटेक एंड आउटपुट हुआ है उसका उनको रिकॉर्ड करना है. सो द राइट आंसर इज द ऑप्शन ए. नेक्स्ट क्वेश्चन नंबर 5. A client is wearing a continuous cardiac monitoring which begins to sound its alarm. A nurse see no electrocardiogram complex on the screen. The first action of the nurse is to: option A, check the client status and lead placement. Option B, press the recorder button on the electrocardiogram console. Option C, call the physician. And option D, call a code blue. सो पेशेंट ने क्या पहन रखा है, कंटिन्यूस कार्डियक मॉनिटरिंग, और सडनली उसके अंदर किसी भी प्रकार की ईसीजी वेव नहीं आ रही है. तो नर्स का पहला एक्शन क्या होगा? तो उस कंडीशन के अंदर नर्स का पहला एक्शन ये होगा कि अपन को वहां पे सबसे पहले पेशेंट का स्टेटस चेक करना है कि जो लीड है वो वहां से डिस्प्लेस तो नहीं हुई है. सो द चेक द क्लाइंट स्टेटस एंड द लीड प्लेसमेंट. सो द राइट आंसर इज द ऑप्शन ए. राइट आंसर इज द ऑप्शन ए. Next question. A nurse is assessing the blood pressure of a client diagnosed with the primary hypertension. The nurse ensure uh, accurate measurement by avoiding which of the following? Option A. Option A. Sitting the client with a arm bed support and at the heart level. Option B. Measuring the blood pressure after the client has been seated quickly for 5 minutes. Option C. Using a cuff with a rubber bladder that that encircles at least 80% of the limb. Option D, taking a blood pressure within 50 minutes after nicotine or caffeine ingestion. So what is the right answer? Right answer is the option D, taking blood pressure within 50 minutes after nicotine and caffeine ingestion. Right answer is option D. Yes, next question. IV heparin therapy is ordered for a client. While implementing this order, a nurse ensures that which of the following medications is available in the nursing unit. पेशेंट को क्या देना है? आपको IV heparin थेरेपी देनी है, और सो आपको क्या वहां पे एंश्योर होना चाहिए? ऑप्शन ए विटामिन के, ऑप्शन बी अमाइनोकॉर्पिक एसिड, ऑप्शन सी पोटेशियम क्लोराइड, and option D protamine sulfate. So IV heparin therapy है, so the right answer is the option D, protamine sulfate. क्या देंगे? protamine sulfate देंगे, because of the protamine sulfate is the antidote of the heparin therapy. So the right answer is the option D. Next question. A client is at risk for the pulmonary embolism and is on anticoagulant therapy with the warfarin. The client's prothrombin time is 20 seconds with a control of 11 seconds. The nurse assess that this result is: option A, the same as the client's own baseline level, lower than the needed therapeutic level. Option C, within the therapeutic range. Option D, higher than the therapeutic range. So the prothrombin time कितना है? 20 सेकेंड. कितना है? 20 सेकेंड. So 20 सेकेंड. The right answer is the option C. ऑप्शन सी, विद इन द थेराप्यूटिक रेंज. नॉर्मल जो लेवल है वो कितना है? ये इसका जो वो थेराप्यूटिक रेंज के अंदर है. सो द राइट आंसर इज द ऑप्शन सी. नेक्स्ट क्वेश्चन. ए client who has been receiving heparin therapy also is start on warfarin. The client asks the nurse why both medications are going administered. In formulating a response, the nurse incorporates the understanding that warfarin. Option A, stimulate the breakdowns of specific clotting factor by the liver, and it takes to 3 days for this to exert as anticoagulant effect. Option B, inhibit synthesis of specific clotting factor in the liver, and it take 3 to 4 days for the medication to exert an anticoagulant effects. Option C, stimulate production of the body owns thrombolytic substance, but it take 2 to 4 days for this to begin. Option D, he has some mechanism of action as heparin, and the crossover time is needed for the serum level of the warfarin to be therapeutic. So what is the right answer? So what is the right answer? The right answer is the option B. What is the right answer? Option B. Inhibit synthesis of the specific clotting factor in the liver and takes 3 to 4 days for the medication to exert an anticoagulant effect. Clear है? What is the right answer? Option B. Next question. A 60-year-old male client come into the emergency department with the complaining of crushing chest pain that indicate to his shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Immediate admission orders include oxygen by nasal cannula at the 4 liter per minute, blood work, chest X-ray, and ECG, and 2 mg of morphine given IV. The nurse should first. So पेशेंट को क्या है वहां पे पेशेंट को डायग्नोसिस हुआ है एक्यूट मायोकार्डियल इन्फेक्शन सो व्हाट इज द प्रायोरिटी ऑफ नर्सिंग फर्स्ट administer the morphine. Option B, obtain 12 load ECG. Option C, obtain the lab work. And the option D, order the chest X-ray. What is the priority? What is the priority? यहाँ पे अपन पेशेंट को क्या देने वाले हैं सबसे पहले administer morphine. So the right answer is the option A. Right answer is the option A. Next question. When administer a thrombolytic drugs to the clients experiencing an MI, the nurse explained to him that the purpose of the drugs is to option A, help keep him well hydrated. Option B, dissolve dissolve clot he may be have, prevent kidney failure, and option D, treat potential cardiac arrhythmias. So पेशेंट को अपन क्या दे रहे हैं यहाँ पे थ्रोम्बोलाइटिक ड्रग्स दे रहे हैं क्या दे रहे हैं थ्रोम्बोलाइटिक ड्रग्स दे रहे हैं सो व्हाट इज द पर्पज ऑफ द ड्रग्स ड्रग्स का पर्पज होगा ऑप्शन नंबर 2 ऑप्शन नंबर बी द डिजॉल्व द क्लोट ठीक है इसलिए इसको अपन वहां पे क्या दे रहे हैं थ्रोम्बोलाइटिक एजेंट सो द राइट आंसर इज द ऑप्शन बी नेक्स्ट क्वेश्चन a client has driven himself to the ER. He is 50 years old, has a history of the hypertension, and informed the nurse that his father died of a heart attack at 16 years of age. The client is presently complaining of the indigestion. The nurse connect him to an ECG monitor and beginning administer oxygen at the 2 liter per minute via nasal cannula. The nurse is next action would to be option A, call for the doctor. Option B, start an IV line. Option C, obtain a portable chest radiograph. Option D, draw blood for laboratory studies. So what is the right answer? Right answer is the option B. Right answer is the option B, start the IV line. Right answer is the option B. Next question, the nurse receiving emergency laboratory result for a client with the chest pain and immediately inform the physician. And increased myoglobin level suggest which of the following? Option A, cancer. Option B, hypertension. Option C, liver disease. And option D, myocardial infarction. Option D, myocardial infarction. So the right answer is the option D, myocardial infarction. Myocardial infarction. जो मायो यहाँ पे लेबोरेटरी वैल्यू के अंदर क्या देखा गया है? मायोग्लोबिन क्या है यहाँ पे? मायोग्लोबिन क्या होता है? कार्डियक मार्कर होता है। क्या होता है? कार्डियक मार्कर। जब मायोकार्डियम जब डैमेज होती है तो वहां से मायोग्लोबिन रिलीज होता है एंड इट इंडिकेटेड द मायोकार्डियल infarction. So the right answer is the option D. Next question. When teaching a client about the propranolol hydrochloride, the nurse should base the information on the knowledge the propranolol hydrochloride. Option A, blocks beta adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. Option B, increase non-epinephrine secretions and thus decrease the blood pressure and heart rate. Option C, is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lower blood pressure. Option D, is an angiotensin converting enzyme inhibitor that reduce blood pressure by blocking the conversion of angiotensinogen first to angiotensin first to angiotensin second. So the what is the purpose of the propranolol hydrochloride? So the right answer is the option A. Blocks the beta adrenergic stimulation and thus cause the decrease the heart rate, myocardial contractility, and the conduction. The right answer is the option A. Next question. Question number 15. The most important long-term goal for the patient with the hypertension would be to. Option A, learn how to avoid stress. Option B, explore a job changes or early retirement. Option C, make a commitment to long-term therapy. Option D, control high blood pressure. So what is the right answer? What is the right answer? The right answer is the option C. Make a commitment to long-term therapy. So the right answer is the option C. Next question. Hypertension is known as the silent killer. This phrase is associated with the facts that hypertension often goes undetected until symptoms of rather symptoms failure occur. This may occur in the form of option A, cerebrovascular accident, liver disease, myocardial infarction, and option D, pulmonary disease. Option D, pulmonary disease. So the right answer is the option A, cerebrovascular accident. Cerebrovascular accident. Right. Clear है? Next question. Which of the following symptoms should be nurse teach the client with the unstable angina to report immediately to her physician? Option A change in the pattern of her pain. Option B, pain during sex. Option C, pain during an argument with her husband. Option D, pain during or after an activity such as lawn mowing. So the right answer is the right answer is the right answer is the option A. Change the pattern of the pain. यानी कि अनस्टेबल एंजाइना का मतलब होता है कि विदाउट एनी रीजन, अगर चेस्ट पेन हो रहा है और पेन का जो पैटर्न चेंज हो रहा है, दैट इंडिकेट द अनस्टेबल एंजाइना. So the right answer is the option A. Next question. The physician referred the client with unstable angina for the cardiac catheterization. The nurse explained to the client that his procedure is being used in the specific case too. Option A. Open and dilate the blocked coronary arteries. Assess the extent to the arterial blockage. Option C. Bypass obstructed vessels. And option D, assess the functional adequacy of the valve and heart muscles. So the right answer is the option B. The right answer is the option B. Assess the extent of cardiac blockage. So the right answer is the option B. Next question. As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets 0.3 mg given the sublingually. This drug is principal effect are produced by the option A, antispasmodic effect on the pericardium. Option B, causing an increased myocardial oxygen demand. Option C, vasodilation of the peripheral vasculature. And option D, improve the conductivity in the myocardium. So ड्रग्स का नाम क्या है? नाइट्रोग्लिसरीन. और नाइट्रोग्लिसरीन आर द किस टाइप की ड्रग है ये? These are the vasodilator. So the right answer is the option C, vasodilation of the peripheral vessels. So the right answer is the option C. Next question. The nurse the nurse teach the client with angina about the common expected side effect of the nitroglycerin including. So the option A, headache. Option B, high blood pressure. Option C, shortness of breath. And option D, stomach cramp. So the right answer is the option A. जो नाइट्रोग्लिसरीन होती है वो वैसोडाइलेटर होती है, और अगर ब्लड वेसल्स डायलेट होगी तो वहां पे हाइपोटेंशन हो सकता है. क्या हो सकता है? हाइपोटेंशन. एंड द अर्ली सिम्टम्स ऑफ द हाइपोटेंशन इज द हेडेक. ठीक है. ये तीनों ऑप्शन बाकी के क्या है? ये हाइपरटेंशन के है. सो द राइट आंसर इज द ऑप्शन ए, हेडेक. क्लियर है? ओके, थैंक यू सो मच. एंड अगर आप टेस्ट सीरीज ज्वाइन करना चाहते हो तो हमारे द नर्स लाइफ एकेडमी एप्लीकेशन को डाउनलोड करें प्ले स्टोर में जाके. लिंक जो है वो डिस्क्रिप्शन के अंदर दिया गया है, वहां से ऐप को डाउनलोड कीजिए, रजिस्टर्ड कीजिए. एंड वहां पे आपको डेली फ्री टेस्ट के नाम पे आपको पर डे 10 क्वेश्चंस मिल रहे हैं, जिसको मैक्सिमम 3 अटेम्प्ट्स तक आप उसको अटेम्प्ट कर सकते हो. और यदि आपको स्पेशल टेस्ट सीरीज ज्वाइन करनी है जो नॉरसेट के लिए है, या सीएचओ एग्जाम के लिए, या अपकमिंग डी ट्रिपल एस ईएसआईसी जीपमेर, या बीएचयू, या एमएससी नर्सिंग, या पोस्ट बीएससी एंट्रेंस एग्जाम के लिए, या आप जीएमईआरएस गुजरात के लिए, देन वहां से आप स्पेशल टेस्ट सीरीज को वहां से आप परचेज कर सकते हो. यदि आपको ऑल प्रीवियस एग्जाम पेपर की जरूरत है तो आप वहां से वो भी आप परचेज कर सकते हो. देन सब्सक्राइब, शेयर एंड द लाइक द यूट्यूब चैनल. एंड थैंक यू फॉर द वाचिंग. बहुत बहुत धन्यवाद. थैंक यू.